Welcome to Pharmacy in Focus, where I will be having pocket-sized conversations on current topics and interests relating to pharmacy and the wider health sector. My name is Sharina Basan, bringing you Pharmacy in Focus on behalf of the Pharmaceutical Society of New Zealand. Welcome to episode 4 of Pharmacy in Focus. Today, I have Judith McCartney with me. Judith is a clinical pharmacist at Ropata Health, a large medical centre in Lower Hutt. She has been a pharmacist for 10 years, working the first 5 years in community pharmacy before picking up part-time work in general practice and continuing her part-time work in community pharmacy. Welcome, Judith.
Hi, thanks for having me.
Now, can you tell me a little bit more about your time working in community pharmacy and what you enjoy most about it?
Yeah, so I spent the first 5 years just in community pharmacy and then have continued working there since starting work in the medical centre. Worked at a few different pharmacies, including locuming, and I really enjoy the ongoing patient care aspect of it and being able to see the effect of helping people. It's just really cool with lots of customer and patient interaction. It's really good.
Great. So you enjoy the patient care perspective and the patient interaction in community pharmacy.
Yeah.
So can you tell me a little bit more now about your role in general practice and what this involves?
Yeah. So a big part of it is medication reviews. We try and target the more complex patients with lots of polypharmacy. We also do reconciliations for patients discharged from hospital and answer lots of different queries from GPs and nurses, some straightforward and then others are really interesting and complex and needing a full literature search. I also do occasional audits and have some input on policies and standing orders. So it's really varied.
Excellent. So you're working in both general practice and community pharmacy now, is that correct?
Yeah, that's right. So 2 days medical centre and just 1 day in community pharmacy.
Great. And you enjoy both roles, but in slightly different ways?
Yeah, they're really different, but really enjoyable. It's good.
And how did you know you wanted to move into general practice from community pharmacy?
So I was talking to a colleague one day, she, Barbara Moore, and she actually was moving into the same type of role, and she was telling me about it, and it just sounded really interesting. I'd been kind of missing a lot of the clinical aspect working in community pharmacy, that I missed from like uni days, and it just sounded really exciting and like a good challenge. So, yeah.
And then the opportunity came up and you took it. Would that be? Yeah,
that's right. So it was the medical centre next door. So I already knew the GPs a little bit, and they knew who I was. So it made that transition a little bit easier.
And I also know you've got a little one at home. So how do you balance the two different types of roles that you're doing as well as being a parent?
Yeah. So I'm able to work just 3 days a week, which is really good. The fact that my job at the medical centre has always been 2 days made that really easy to go back to. And then I've actually only just started the extra day a week at community just the last month or two. So I get to spend a couple of days at home with my little one, and she goes to daycare, but I'm able to do shorter hours, so that makes it a lot easier with pick up and drop off.
Right. And can you tell me what you think your biggest accomplishment is to date?
I think just getting out of my comfort zone and applying for this job, and just going for it was a pretty big jump for me. I didn't have the postgrad study at the time. I got straight into that once I started. so yeah, for me, it was applying for something that I didn't feel qualified for. I probably should have had the postgrad already, but yeah, and also just working in a medical centre full of a lot more outgoing people. It's a much bigger work environment. Pharmacies tend to be full of introverts and much smaller, so it was quite a challenge, but yeah, I'm glad that I did it. It's been so rewarding.
So you've mentioned getting out of your comfort zone is probably one of your biggest accomplishments, and it certainly would be for someone who is an introvert, and for anyone really going into a completely new environment. You've also mentioned you didn't have a postgrad qualification, and so that is also can lead to a bit of anxiety, I guess, because then that led you to not feel qualified for the role that you were going for. So would you say that your biggest accomplishment was kind of facing your biggest challenge, so to speak?
Yeah.
And recognizing that you didn't feel qualified, I guess you didn't quite know the role that you were getting into. How did you find that transition to working into general practice?
It was quite hard. It was definitely a big challenge. So when I started, there'd been a gap where there was no pharmacist. So the practice manager had worked with a pharmacist before, and a lot of the GPs hadn't. So kind of no one knew what I should be doing, which was quite difficult to establish myself in that role. I read a lot about what pharmacists were doing in other general practices. There were some reports written. So I had some ideas of what could be done. I was sort of suggested to do an audit to start with because the GPs needed that for their registration. So I started that, then made a list of polypharmacy patients, started reviewing them. Slowly the med-info queries came through, and it just gradually built up and built up. Quite hard just working on my own, but then since then I've been in touch with the team at the other PHO nearby, so it's really good having them to I guess bounce ideas off and just check that we're all on the right track. It's made it much easier, and now I actually work alongside another pharmacist, so we've got two of us doing 2 days a week, which is really good to have her there as well, and we can work together.
Wonderful. So it's growing in that particular medical practice.
Yeah, and I also find that some of the newer GPs are more familiar with the role. So I've had GPs come in who have worked with a pharmacist before at their previous medical centre, or one from the UK had worked with pharmacists over there. So I feel like it's becoming a much more common role, and so people know more about what we do already, which is cool.
It would definitely be helpful if people understand what your role is and welcome that. When you first started this role, you did say that there was a gap of a period of time when a previous pharmacist had left and you starting. How did you feel about your first recommendation of doing an audit, or looking at polypharmacy, and how did the GPs take to this new pharmacist coming in and making these recommendations?
Well, for the first audit, I picked something that I felt would be easy to do, and also something that is very medicines focused. So I think I picked the making sure that people who are on dabigatran have had renal function testing. It was one that they were doing pretty well at already, so it made it a bit easier reporting the results to them. And yeah, that just helped. It gave me something to do while I was getting a bit more established. They all seemed to, I don't know, from what I've heard anyway, they seem to like having a pharmacist to ask multiple different questions solved and stuff. Some GPs will send through more queries than others. And over time, just getting to know the different GPs and who sends through what queries. Yeah.
Great. Thank you very much. So, Judith, we're now going to go on to the next section of this conversation, and I'm just wondering, what do you think? What is it that people need to think about before moving into a different area of practice, which in this case would be general practice?
So I think it's I know that I moved into it before I did my postgrad, but I would say if people are wanting to move into general practice, it's really good to have the postgrad certificate in clinical pharmacy. Everything I was studying was directly applicable to my work. I was just slightly adjusting my assignments and for a bulletin and sending that out to the GPs. It was just exactly the same as what I was needing. So it was really good and really enhanced how well my research was for reviews and queries. It was really difficult doing the work without having that that study already done. So I'd definitely recommend that. The diploma is useful, but the certificate is, I'd say, crucial. Also try and see if there's any pharmacists in general practice in your area. Have a chat to them, see how they got into it, how it's set up as well. I think, so I'm employed by a medical centre, but then other setups, they're employed by the PHO and sometimes maybe they're DHB. I'm not sure, it's different in each area, so that would be worth finding out about. And then just having the support of other pharmacists in general practice. They might hear about when there's a job come up. It's really just get in touch with people who are nearby. And if there isn't anyone, then have a chat to your local GP and see if it's something that they've considered. They might be looking into it for things like healthcare homes setup that they've got, or the long-term conditions program.
And that's great advice. So having a chat to other pharmacists that are in these roles already, and even if you don't know anyone directly, you might have some friends who do know pharmacists that are in general practice. If you don't know anyone, then you now know Judith. Otherwise, having a conversation with GPs that you have some connection with through your current role, that's great advice. Just going back to the postgraduate studies, you said you didn't have postgraduate qualification initially, but you've said how extremely useful and practical that certificate was to your current role. Now, I know there's been a lot of conversations about pharmacists' pay and costs of things, etc. And there may be some pharmacists out there that think, well, for me to do this, I would need to have the practice pay for it. And then there might be others that are quite happy to go through and self-fund as well. Do you have any comments on that?
If you can get the medical centre or whoever's employing you to help fund that, then that's fantastic, because it will make you a better pharmacist to have employed. But if not, I mean, I still had my student loan going, so I just added it to that. It seemed like quite a bit at the time, but overall it's not that big a cost when it is so crucial to doing the job that I love doing. And there was a bit of a pay jump as well, so that helped to pay for the postgrad. Yeah.
So from what you're saying, yes, it's helpful if the PHO, DHB, etc., is able to help fund or support your training. However, there is a lot of benefit in having this qualification for you to do a pharmacist role in general practice. And so self-funding shouldn't be seen as a negative, but should actually be, you're taken on board as in the long term, it's going to be beneficial for you, not just in pay, but for your knowledge and ability to do the job really well.
And being able to put it on student loan means that it's not really an upfront cost, which makes that a lot easier.
Makes a huge difference, definitely. Great. Just moving on to, you've talked a little bit about the postgraduate being very beneficial for you to be able to do your job even better than you were when you first started. Well, are there any other skills that you would say pharmacists would need to work in general practice outside of the clinical knowledge that you'll gain from the postgraduate qualification?
I guess like with the reviews, we sort of write a summary. So I guess like writing that in succinctly as well. The study covers like all of the research and everything that I end up doing. So it's, the research and reviews is all covered. I guess communication skills, which would be needed in the postgrad as well. But it's definitely crucial. So written communication and spoken as well. Prioritizing things, and I guess sometimes there's an aspect of making your own work. So when you're in community pharmacy, you have all the work given to you. Patients bring in prescriptions, they come through on the email. Like you know what you're needing to do for the next hours, days, whatever. Whereas in general practice, often there isn't someone there who tells you this is your task for today. Sometimes there'll be patients referred, there'll be questions to answer, but often it is a lot of working out how you're going to prioritize patients to review. You'll be deciding, are you going to focus on polypharmacy? Are you going to focus on interactions? Working out what audit to do and prioritizing that to make sure it's done on time. And it is a lot of time management and creating enough work, but not just finding the right work to be the most useful.
So would you say with these roles, especially if you're in one where you're not specifically being told that these are your tasks for today, that you're having to think about how you can best provide value to the patients and your other medical colleagues at the medical center? Would that be
Yeah.
So communication skills, written and spoken, prioritizing, time management, and looking at where you can provide the most value when it comes to making your own work, so to speak. Excellent.
I think there's also an aspect of sort of advocating for yourself in your role. It's very easy when you're working with multiple GPs, multiple nurses, big admin team to sort of speak up and say, hey, that's the thing pharmacy can do, or hey, why don't we do this? We could do this way, and I would be good to be able to do that. I guess it's working out where a pharmacist can add benefit, or where you can add benefit as well, and speaking up about it, because the others don't necessarily know. They might not think about it. So I think that is a big thing. And when there's when other people are more outgoing, they naturally just make themselves heard, whereas a lot of pharmacists are less outgoing and find that a bit more difficult.
You did mention that how some of our colleagues can be introverted, and I guess there's a different degree of introversion as well. So as you say, advocating for yourself and in effect for the profession when it comes to what it is that that you can provide, and having the confidence to verbalize that even though you might think, oh, they might think I'm silly saying that, but actually, if you don't verbalize it, it's very possible that other people in the room don't know what it is that you could do and how you can best support whatever the goal is.
Yeah.
Excellent. That's great advice as well. And finally, what tips do you have for anyone wanting to move into general practice?
Look into that postgrad certificate and talk to pharmacists who you know are in general practice, or ask around, see if it's a thing that's in your area, and start to focus a bit more on the clinical aspects of things if it's not something that you do already. So reading the BPAC articles about newer treatments and things, and looking beyond what you would need for just dispensing them and talking to the patient. Start to look into the areas that you're less familiar with all the medicines. So things like interpreting lab results was something that I did not know that much about when I started. So things like that could make it a bit easier to transition over.
Right. So stretching your current knowledge.
Yeah.
Fantastic. Well, there you go, everyone. So for those that haven't done a postgrad search, you might want to look into what and how you can go about that. Talking to other pharmacists that are in a similar role to Judith's, and stretching your current knowledge base. If that's something you're not doing already, which I'm sure a lot of our colleagues are, but possibly in a different direction as well, depending on what your interests are and the type of role that you're wanting to move into. Now, Judith, just on a final note, I do recall you mentioning that most of the medical practices in your area have a pharmacist working within them, at least on a part-time basis. Is that right?
Yeah, that's right. Yes, that's in Lower Hutt, or the whole of the Hutt Valley, I think. Yeah.
Fantastic. So you have a few colleagues that you can call upon, and they can call upon you and each other when you have any questions or queries.
Yeah, that's really good knowing them.
Excellent. So you have a support network in place now. I'm sure it would have started with one person, but now it's grown to a team, which is excellent.
Yeah, that's really good.
Great. Well, thank you so much for your time, Judith. It's been really helpful to sort of open up what life is like in general practice, and hopefully some people that are listening might start thinking about, is this something that's right for me, and start having conversations, even if a role isn't currently available. It might eventuate in the near future.
Yeah.
Great. Thanks very much.
Cool. Thank you.